Our dear viewers, welcome to a new episode. Please click the subscribe button to encourage us to publish more medical information. In the past, it was believed that gastric ulcers develop due to unhealthy lifestyle such as heavy smoking, excessive intake of spicy foods, exposure to physical or emotional stress, etc. But later, medical studies showed that Helicobacter pylori infection is the most common cause of gastric ulcers, while the above-mentioned factors increase the incidence of gastric ulcers. Helicobacter pylori infection is a bacterial infection caused by H. pylori which invades the gut, mainly stomach and duodenum, where it causes multiple damages to the mucosal lining of the stomach. These damages leads to gastric ulcers, which may bleed, become infected or even negatively affect the functional role of the stomach in food digestion. Also, these gastric ulcers increase the risk of stomach cancer. The definite cause of Helicobacter pylori infection still unclear, but some medical studies showed that it could develop due to ingestion of unclean water, eating contaminated food and poor sanitation. On the same context, infection could develop in cases of direct contact with saliva or stool of infected people. Helicobacter pylori infection could be asymptomatic for many people. Clinical signs appear when the patient develops gastric ulcer, which is manifested by the following. 1. Epigastric pain, at the site of the stomach, which is usually relived by eating. 2. Nausea and vomiting. 3. Abdominal distension. 4. Poor appetite. 5. Weight loss. Untreated gastric ulcer is a serious health problem, as it can bleed and cause the following clinical manifestations. 1. Hematemesis, vomiting of blood. 2. Dark or black stool. 3. Severe gastric pain. 4. Anemia due to continuous blood loss, manifested with pale skin, brittle nails, shortness of breathing, persistent fatigue, dizziness. Proper diagnosis of Helicobacter pylori infection is initiated by examination of the patient's medical history and current symptoms. After that, physical examination is done, in the epigastric area. Lab investigations usually include test of Helicobacter pylori and stool analysis. Also, upper GIT endoscopy and biopsy may be done in advanced or complicated cases as in bleeding ulcer, infected ulcer and suspected stomach cancer. Cases of Helicobacter pylori are usually treated by antibiotics, such as amoxicillin and metronidazole, to kill the organism. Also, it's recommended to use medications that reduce gastric acidity, such as omeprazole and pantoprazole. This regimen of medications is recommended to be followed for at least 2 weeks. Some patients may need more time to reach full recovery. On the other side, to avoid Helicobacter pylori infection, it's necessary to follow these tips. 1. It's important to take care of personal hygiene. So, it's advised to wash your hands after using the bathroom. Also, hands should be washed carefully before preparing the food and before eating. 2. Avoid drinking unclean water. Also, foods of unknown sources should be avoided. 3. Eating undercooked foods, like sushi, increases the risk of Helicobacter pylori infection. So, it should be always avoided. 4. If you experience symptoms like epigastric pain, dark stool, persistent abdominal distension, etc., you should seek immediate medical advice for proper assessment and evaluation of the condition. Support the channel to encourage us to publish more.